Three pharmaceutical giants control nearly 90% of the world's insulin supply. A century-old drug that costs just $2 to manufacture is sold for over $300 in America, while the same vial goes for just $6 in Canada and a single dollar through Doctors Without Borders. Right now, 8.4 million Americans depend on insulin to survive. Yet 1 in 4 of them is rationing doses, gambling with their health just to make rent or buy groceries. Some survive for a while, many don't, and behind it all, a $22 billion conspiracy, carefully designed, perfectly coordinated, and devastating millions of lives. This is the dark truth of insulin. When we talk about numbers like 8.4 million patients, it's easy to forget that each one is a human being with a name, a family, and a story. Jesse Lutkin was 32 years old, living in Iowa, when he died in 2018. His insulin prescription cost him more than $1,000 a month, an impossible burden for a working-class man. He tried stretching his doses, making each vial last longer than it should. His body couldn't keep up, and within weeks, his life was gone. Jeremy Crawford, age 39, from Texas, suffered a similar fate. In 2019, faced with mounting costs, he experimented with cheaper alternatives when his insurance wouldn't cover the insulin brand he needed. Those alternatives failed, and his body shut down. Alex Smith, just 26, from Minnesota, died in 2017. He had just aged out of his parents' insurance, suddenly responsible for his own medical expenses. The sticker shock of insulin prices crushed him. He tried rationing. His body didn't make it through the month. These aren't isolated tragedies. They're repeating, predictable outcomes. They're the human casualties of a business model that puts profits before people. Now let's look at the bigger picture. 8.4 million Americans need insulin to live. That's not optional. It's not like buying a new phone or skipping a night out. Without insulin, their bodies shut down. Yet 1 in 4 of these patients, over 2 million people, are rationing their doses each month. That's 2 million people essentially playing Russian roulette with their pancreas, hoping they can stretch their supply just enough to make it to payday. And here's what's horrifying. Rationing doesn't just make life harder. It triples the risk of death. Doctors know this. Companies know this. The math is clear. By pricing insulin so high, they're knowingly forcing millions into life-threatening situations. It's not a bug in the system. It's the system working exactly as designed. Insulin isn't some revolutionary new breakthrough that costs billions in research. In fact, the formula has been essentially unchanged for decades. Back in 1999, a vial of insulin cost $21. Today, that same vial sells for over $300. Nothing about the drug itself has changed. The formula is the same. The production process is the same. The cost to manufacture still ranges between $2 and $5 per vial. But the price tag, that's multiplied 15 times over. The extra $295 doesn't pay for innovation or improved care. It doesn't fund new discoveries. It's pure profit, dressed up as progress. The industry will tell you they've improved delivery systems or added convenience features, but those excuses crumble under scrutiny. It's not innovation driving prices up. It's corporate greed, plain and simple. So how do these companies keep their monopoly going, decade after decade? The answer lies in a tactic called patent evergreening. The original insulin patent dates back to 1923, and the scientists who discovered it sold it for just $1, hoping it would always remain affordable. But Big Pharma found a way to twist that generosity. Instead of innovating, they make small tweaks, changing the delivery pen, altering the formula slightly, or rebranding the packaging. And then they file dozens of new patents. Each one extends their control, blocking generic competition and locking in their monopoly for another 20 years. Over time, companies like Eli Lilly, Novo Nordisk, and Sanofi have filed 70-plus patents each on insulin-related products. These aren't scientific breakthroughs. They're legal loopholes. By exploiting the patent system, Big Pharma keeps competitors out of the market and keeps prices sky high. You'd think 3 major companies controlling insulin would mean competition, right? Wrong. Instead of competing, they behave like a cartel. From 2007 to 2016, Eli Lilly, Novo Nordisk, and Sanofi raised their prices in perfect lockstep. Sometimes, they raise them on the exact same day. The numbers are damning. Humalog went from $74 to $269. Novolog jumped from $55 to $289. Lantus rose from $88 to $269. That's not market forces. That's collusion. It's cartel behavior wearing a lab coat. And the victims aren't rival companies. They're the millions of patients trapped with no other options. But the story gets even murkier when you bring in pharmacy benefit managers, or PBMs. These middlemen are supposed to negotiate drug prices on behalf of insurers. Instead, they've become part of the racket. PBMs demand massive rebates, sometimes up to 70% of the list price. To pay these rebates, insulin manufacturers jack up the sticker price. Everyone in the chain wins. Manufacturers maintain their market dominance. PBMs collect fat fees. Insurers get to claim discounts. The only loser is the patient, who's stuck paying copays based on the inflated list price. In other words, the high prices aren't an accident. They're baked into the system. They're intentional. Let's break this scam down in simple terms. A manufacturer sets the insulin list price at $300. Then they give a $200 rebate to the PBM. The PBM pockets $50, passes $150 to the insurer, and everyone celebrates the savings. But the patient at the pharmacy counter, they're still charged a copay based on that original $300 sticker price. Well, it's like a discount on paper is nothing more than a shell game. It's a kickback scheme disguised as healthcare. And while the corporations shuffle money between themselves, the diabetic patient has to decide between insulin or rent, between life or death. The most damning evidence is global comparison. The exact same vial of insulin sells for $6 in Canada. In South Africa, it's just $2. And organizations like Doctors Without Borders can buy it for as little as $1. Same drug, same factories, same production process. The only difference? The price tag in America. Americans are paying $50, even 100 times more than the rest of the world. Why? Because the system allows it. Because patients here are treated not as people in need, but as hostages in a legal extortion racket. Even the so-called reforms are smoke and mirrors. Yes, Medicare now caps insulin at $35, but that only helps seniors. Yes, some companies announced voluntary caps at $35 per month, but those caps are not law. They're public relations stunts that can vanish whenever the companies feel like it. And the real tragedy, 71% of Americans who ration their insulin are under the age of 65. They're not covered by Medicare's cap. They're not protected by the PR campaigns. They're still paying full price, still rationing, still dying. The machine keeps grinding. The deaths keep adding up. And reform is little more than political theater. But recently, the fortress has started to crack. In April 2025, the Federal Trade Commission filed lawsuits against PBMs, accusing them of creating perverse incentives that inflate prices. The Massachusetts Attorney General is suing all three major insulin makers, along with the PBMs, for coordinated price fixing. And across the nation, more than 400 federal court cases are piling up against these companies. The evidence is overwhelming. Emails, data, internal documents. This isn't speculation anymore. It's organized theft, laid bare in black and white. Meanwhile, the prophets tell their own story. Eli Lilly posted $34 billion in revenue in 2024. Novo Nordisk is reporting record profits. Sanofi executives are cashing in multi-million-dollar bonuses. While they toasted their financial success, families are left burying their children. In one heartbreaking protest, grieving parents delivered their sons' ashes to Eli Lilly headquarters as a symbol of what these prices cost in human lives. This isn't free market capitalism. This is murder with a profit margin. And every balance sheet soaked in billions is also soaked in blood. The solution isn't a mystery. We know what needs to be done. Break the patent stranglehold. Ban the rebate shell games. Enforce universal $35 caps for everyone, not just seniors. Allow imports from Canada and other countries where insulin is affordable. None of this is rocket science. But it doesn't happen for one reason: political will. Congress won't act because the pharmaceutical industry owns them. In 2023 alone, Big Pharma spent $374 million lobbying lawmakers. That money buys silence. It buys inaction. It buys senators. And here's the cruel irony. Dead diabetics don't lobby. They don't donate. They don't vote. Their silence, bought with inflated insulin prices, is the final piece of the business model. Insulin was discovered over a century ago and sold for $1 to save lives. Today, it's the centerpiece of a $22 billion extortion racket. Behind the numbers are millions of human stories, lives cut short, families torn apart, dreams ended too soon. And until this system is dismantled, every vial of overpriced insulin isn't just medicine. It's a death sentence with a barcode. The question is, how much longer will we let greed decide who gets to live and who doesn't?